supportive community action team. So we'll just give it a few more moments.
Where'd it come?
You just want to make sure you mute yourselves. We got a couple of conversations coming through. Thank you, thank you. So I hope all is well this morning. We're really excited to go ahead and get things going here. And once again, thank you all for coming. We got a pretty full layout for you today. So with us coming off of the holidays, and I know this is just like a pretty busy time of year as well. What I would like to do is for us to get into an exercise, a mindful exercise, just to bring us more present, just to center us, and so that we can focus and bring our best selves and into a safe place. So we're going to go ahead and jump right into a mindful exercise once again. Good morning, and we'll go ahead and get that started now.
Mindful breathing. Close your eyes and rest your hands on your knees. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you're comfortable. Take a few deep breaths. While you're breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall each time you breathe in and each time you breathe out. And just allow your breathing to be natural and relaxed. Now bring your attention to the feeling of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each time you breathe in and each time you breathe out. As you inhale, maybe your breath feels cool. And as you exhale, maybe it feels a little warmer. When your mind wanders, or if you become distracted, just notice what's going on in your head, and then gently bring your attention back to your breath, going in and out. Focus on the feeling of your breath and allow thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat and open your eyes.
All right. Good morning again, everyone. Thank you so much for coming. I hope that exercise really grounded you and just brought you more present. For those of you who may not have heard, my name is Ellie Freeman, and I'm the community co-chair for the Safe and Supportive Communities Action Team. So um, thank you again for coming to the Q4 Safe and Supportive Community Action Team meeting today. Let's go ahead and go to the next slide. So today's agenda is pretty packed, and we are really looking forward to just jumping in and getting right to it. So from 10:30 to 10:40, we'll go ahead and go over ground rules, mindfulness exercise and introduction. 10:40 to 10:55, we're going to do the presentation on MKE Promise Zone survey. 10:55 to 11:10, we'll have the MKE Elevate Data Inventory Plan. 11:10 to 11:30, we're going to get into implementation partner spotlight. We're going to have a presentation from West Care Incorporated. 11:30 to 11:40 a.m., we're going to do a 90-day implementation. So we're going to discuss all things about that with the MKE Elevate Safe and Supportive Community Plan. 11:40 to 11:55, we will have a breakout session. So this is just action planning prioritization for next year. And then towards the end, the last 5 minutes, 11:55 until 12 noon, we'll do question and answer. Next slide, please. All right, so we're going to go over the shared agreements. So just keep in mind to step up, step back. This is a safe space, so we want to respect each other's time and expertise. Please feel free to jump in and share when, in the chat throughout the meeting if you have things that are important that you want to share. We also want to support each other's learning process. So, no question is a dumb question or anything like that. This is a safe space. Elevate the expertise of lived experience. We're going to come ready to listen, to understand, and to support one another. And remember our North Star, which is the health of all people and neighborhoods in Milwaukee. Next slide, please. All right, so the purpose of today's meeting, we're going to go ahead and share partner organization initiatives that aligned with MKE Elevate Safe and Supportive Community Goals. Provide updates on MKE Elevate progress and the 90-day plan. Priority goals, objectives, and strategies for next year, which is just around the corner. And we're also going to go ahead and share policy advocacy strategy. So this is pretty much to increase awareness of mobile crisis response as a strategy under goal 4, which is to improve availability and uptake of behavioral health resources. All right. So I'll go ahead and turn it over to Amanda for the icebreaker here.
I'll take care of that one. So hi everyone, my name is Alexandria Cohn and I'm a public health strategist with the health department. And our icebreaker today is, what is your window of tolerance today? And so if you guys look on the right side of the screen, there's this window of tolerance that kind of guides how you are showing up in this space today. So it helps people within the space identify where we're at collectively. It helps the facilitators understand where we are at collectively. We're all coming in from different meetings, from different spaces, and with different, like where we're at in our mind and our body. And so what we're going to do is on the top of your screen, you are going to see an options button, and you're going to click that, the view options, and then the third one down, it's going to say annotate. You're then going to click the annotate, and then you are going to, you can grab a stamp, a check mark, whatever makes you feel the best. And then you are going to put down where you are. So if you're in the middle, you're in the comfort zone, you're feeling calm, cool, collected, and connected. If you're hypo-aroused, you're kind of feeling the lower end, maybe just a little disassociation, not fully present in the space, which is totally fine. We're human. And then on the higher end is the hyper-aroused. So maybe a lot of anxiety, overwhelmed, got a lot of due dates coming up. Your mind's just kind of racing and not present in this moment, which is right. Okay, we're all in different spaces. So just pick where you are at. And then in the chat, if you could please share your name, your organization, and why did you become a safe and supportive action team member? And then while we're doing the window of tolerance, we can see in the chat where everyone's coming from. And I also invite you all to use this within your own meetings. I think it really helps guide and center all of us. I use it in really big meetings like this one. I use it in really small meetings. And it just gets everyone a chance to kind of say where they are, where they're at. So. All right, you're going to turn on annotate. If you go away on the top of your screen, there should be a view options bar. And then if you click that, there's an annotate option. All right, getting some people in the chat. We got University of Wisconsin-Milwaukee, Center for Urban Population Center, the Wisconsin Office of Children's Mental Health, Office of Community Wellness and Safety, Wraparound Milwaukee, Freighter Health, WestCare, Sojourner, the YWCA Collaborative Work Group, Nursing Students from Alverno. We have the Colstack Medical College, so OD Fast, the Milwaukee Fire Department. So a lot of really cool people showing up to this space. And I think it's really cool to see just the vast amount of organizations and people who collectively want to make Milwaukee a healthier and safer place. So I am going to mute, and then I think we can carry on while people are introducing themselves in the chat. Also, if you are named Robert Walker on the meeting chat, you can change your name to your name. I think it's funny. I came in and there was like 10 Robert Walkers.
Okay, thank you everybody for just sharing your name, where you're from. So much appreciated. And it's such a wide range of agencies that are being represented here throughout Milwaukee. So I just thank you so much for your time there. So we'll get into the vision. Milwaukee, the vision is pretty much a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. Our mission is, as MKE Elevate, supports a Milwaukee where all people are thriving in a safe, healthy, equitable neighborhoods free from oppression by aligning strategies and building power partnerships, access to resources, and opportunities for collective advocacy in community identified priority areas. So once again, if you haven't done so, please continue to just add your information onto the chat. But right now, I will go to the next screen and I'll turn it over to Quinn so that he can tell us more about the MKE Promise Zones.
Good morning, everyone. I'm Quinn Taylor. Hopefully you can hear me fine. I'm having some audio difficulties with my device here, so I have to use my phone as well. But I'm Quinn Taylor. I serve as a Community Violence Prevention Program Coordinator with the Office of Community Wellness and Safety. I also oversee our keepers and our Milwaukee MKE promise zones. Next slide. So a little bit about the Office of Community Wellness and Safety. The office is dedicated to advancing the well-being and security of our community. Its mission is to enhance community engagement, particularly by empowering youth, supporting families, and strengthening the overall fabric of our community. Through a variety of strategic initiatives and partnerships, the office works tirelessly to create a safer and more thriving environment for our residents. And just a little bit about some of the photos in this slide. You see the young adults on the stairs. That's actually at the Pfizer Forum. So last year we had the opportunity to hire 60 young adults to be ambassadors during the playoffs. Those ambassadors were our game changers. So they lead a lot of our youth-led initiatives throughout the city of Milwaukee. Next slide. Milwaukee Promise Zones Initiative. The Milwaukee Promise Zone program was inspired by a federal Promise Neighborhood Zone program that began during President Barack Obama's time in office in 2023. For those of you who don't know who Barack was, that's our 44th president. He served from 2009 to 2017. This allowed cities and neighborhoods to form a partnership with HUD and DOE to create jobs, increase economic activity, improve educational opportunities, leverage private investment, and reduce violent crime. Milwaukee was inspired by this initiative, and those goals remain paramount. Next slide. In early 2017, the Milwaukee Promise Zone Initiative was rolled out by Alderman, at the time, Alderman Hamilton, who is now the director of the Office of Community Wellness and Safety, and other council members as a multi-pronged approach to spur positive change in 4 designated promise zones. Those promise zones is listed on the map to the right. It's Greater Old North Milwaukee, Washington Park, Harambe, North Division, and the near South Side. Community partners, city agencies, and common council representatives focus on improving economic activity, creating jobs, increasing educational opportunities, and enhancing healthy neighborhoods through a place-based strategy. The economic opportunity zones were created in the Federal Tax Cut and Jobs Act of 2017. Next slide. The purpose of the promise zones. The purpose was running surveys in MKE promise zones served a multifaceted purpose. It enables the assessment of community needs, engages residents in decision-making, and foster data-driven policymaking. In essence, these surveys empower communities, inform resource allocation, and contribute to overall well-being of MKE promise zones residents. That process, the Office of Community Wellness and Safety, with the dedicated efforts of Promise Keepers personnel, conducted a community survey spanning from July to September of 2023, beginning with the Milwaukee Promise Zones neighborhoods and extending to adjacent areas. Remarkably, we were able to gather an impressive 2,000 responses. The comprehensive approach involved a combination of in-person surveys, telephone interviews, and online questionnaires to ensure a broad representation of voices. Not to mention the aggressive nudge from Ferris, who you'll hear from shortly, who really helped to keep our Promise Keepers motivated and getting those surveys completed. Next slide. And now Ferris will take over, who is the epidemiologist for the health department.
Thank you, Quinn. So like Quinn said, my name is Ferris Rizek. I'm the community health epidemiologist here at the City Milwaukee Health Department. So just a little background. So what we wanted to do was we wanted to hear the voices of the individuals that lived especially in the promise zones. So our goal, our target was to get at least 60% of the participations in the promise zones, and then we can extend it also to the adjacent areas around the promise zones. So for the first question, so I'll go over the data of the survey. And our first question was in our survey is to include a comprehensive set of 8 questions to gather valuable insights. And the first question we wanted to ask was, what was the current residential location? So our top 10 neighborhood participations was as followed. Harambe as number 1, Old North Milwaukee number 2, 3 was Arlington Heights, 4 was historic Mitchell Street, 5 was North Division, 6 was Lincoln Village, 7 was Franklin Heights, 8 was Washington Park, 9 was Sherman Park, and then 10 was Midtown. And what was really good about this was that it was a text field, so they can actually give us their residential address. And we had around, I would say like around 2,100. And we had 2,000 participants that actually provided their residential location, which was amazing. And this is how we got our results from. The next question, next slide, please. And for question 2, basically we asked the participants which issue below are important to your neighborhood. So this survey on neighborhood priorities with 2,000 responses allowed for a multiple selection, reveals a diverse range of our community concerns. Most notably, access to safe spaces emerges as the top priority, emphasizing the significance of safety and well-being. Additionally, youth programs and work job training underscores the importance of youth engagement and employment opportunities. The community also placed the high value on access to healthy mental health services and quality of education for school-aged children, showcasing their concerns for healthcare access and educational well-being. And then also services and programs for seniors reflects the community's commitment to supporting its elderly population. This data provides a comprehensive view of the neighborhood priorities, informing future initiatives aimed at creating a secure, inclusive, and prosperous community for residents of all ages. Next slide. For question 3, we asked, what would you prefer to see more of in your neighborhood? Here, this survey question was an open-ended question, so it wasn't like how question 2 was. This would allow the residents to provide a qualitative insights regarding their preferences for neighborhood improvements. The results of this qualitative analysis revealed a diverse range of perspectives. In the survey of the community priorities, participants' response indicates a clear focus on several key areas. Mentorship and youth programs emerges as the top priority, reflecting a strong community interest in youth development and guidance. Community building and unity, police presence also showed a significant importance, highlighting the desire for unity and security within the community. Also, resources and outreach and economic opportunities and jobs underscores the need for community support and employment prospects. Cleanliness and maintenance signifies the importance of a well-kept environment, while transportation, education, access to healthy foods, and religious faith-based activities represents various facets of community life that the participants found significant. Next slide. For question 4, what would you prefer to see less of now? So we flipped the question. So the third question was more. Now we want to ask the participants, what do they want to see less in their neighborhoods? And clearly you could see here, this was also an open-ended question, enabling the residents to share their qualitative insights. And the results of that analysis shows a diverse range of perspectives. Respondents identified a range of concerns with topics like gun violence, crime, and drug-related activity, signifying a strong community desire for enhanced safety and law enforcement. Other concerns included related to the neighborhood stability and safety, such as gangs, abandoned housing. And then lastly, you could see liquor stores and nuisance being represented as well. Next. So for question 5, we asked basically the participant, would you participate in neighborhood events? And I highlighted in this question, it would basically be like neighborhood cleanups, community outreach events, any town hall meetings. And you could see the results here, 91.4% said they would participate in such. This basically, and to get the exact number, it was 1,828 participants that said that they would do this. And this basically will show you the commitment of the community itself, that they are willing to participate in such events from our from if it's from held by the health department or from our community partners as well. Next slide. So for questions 6 and 7, we wanted to understand the safety perspective. So we asked whether they have been a victim in their neighborhood and how they perceived safety levels. The survey on our neighborhood's safety perception revealed a diverse range of feeling among residents, spanning from those who feel very safe to those who feel somewhat or very unsafe. These varied perceptions emphasize the importance of addressing community safety concerns and enhancing residents' feeling of security. These findings underscore the need for proactive safety measures and support for those who are affected by crime, further emphasizing the importance of addressing neighborhood safety comprehensively. And if you look at it here, for question 6, we asked how safe do you feel in your neighborhood? Around 50% said somewhat safe. And for question 7, in the past 3 years, have you been a victim of crime in your neighborhood? 71.9% said no. And next slide. For question 8, we wanted to know how the neighborhood and the community gets their information from. And here, the survey revealed a diverse range of channels for staying informed. The majority of respondents relied on word of mouth to learn about local happenings, highlighting the significance of community connections and interpersonal communication. Social media was second, and it also emphasizes the role of like online platforms in disseminating neighborhood information. And then you could see the traditional information like television, radio, and community journals were at the lower end as well. Next slide. And I'm just gonna drink a little water. Sorry about that. So now I wanted to show you guys the geographic distribution, but specifically tied to the Milwaukee Promise Zones. So like Quinn said, there are 4 Promise Zones currently: Greater Old North Milwaukee, Washington Park, near Southside, and North Division Harambe. For North Division, Harambe was our actually #1 Promise Zone participants at 20%, and it had about 400 responses. Following that was the near Southside, which had 380 responses at 19% of total responses, and then Washington Park, and then Greater Old North Milwaukee. So our target, like I said, was about 60% to get participants from the Promise Zones. And we actually achieved that, and we got 67% of the participants in our surveys was from the Promise Zones. 33% was actually outside of the Promise Zones at 660 responses. Next slide. So now this is in-depth, deeper look at each Promise Zone. So for the first one, we have the Greater Old North Milwaukee. So I just took a sample question. So which issues are important to your neighborhood? So this is going to be, that question is going to be for every Promise Zone too. But I just wanted to show you guys the results on this. So 49% of the total responses actually had an importance was youth programs. Following that was access to safe spaces, and then access to healthy mental health services was at 10%, and then 7% was access to healthy foods, and then 1% was basically other options. Next question, next slide. And for our Washington Park, can you go back? I'm sorry. Let me just explain the map. Thank you so much. So here you could look at, so we have McGovern, we have Old North Milwaukee, and we're looking at the map, and then other neighborhoods. So our number one neighborhood in that promise zone was actually Old North Milwaukee for the participant results. Now, if we look at the next slide, for Washington Park, we have Washington Park. We have as our number one, we have Midtown, Franklin Heights, Amani. So we are getting participation in a lot of the neighborhoods within the promise zone too. So here, same question, which issues are important to your neighborhood? We had 41% also echoed youth programs, and then 25% was access to safe spaces, 17% access to healthy mental health services, and then 13% access to healthy foods. And next slide. And for our near south side, our number one targeted neighborhood was Lincoln Village, Historic Mitchell, and Clark Square. And it's basically, if you're noticing a pattern, a lot of the promise zones are echoing the same importance, which is here 43% youth programs. The only thing different was the second response, which was work, job training at 29%, but then you could see access to safe spaces and access to health and mental health services are still are really important in these neighborhoods, especially in the promise zones. And then our final promise zone, next slide, is the North Division and Harambe. Here you could see we got a lot of survey responses in the Harambe area, North Division area, Birchfield, Amani, Midtown, and then Brewers Hill. And same thing all across from the promise zones and the neighborhoods. We have 55% wanting youth programs, 26% wanting access to safe spaces, work, job training, access to indoor, outdoor recreational program was the only difference here. So in summary, this comprehensive community needs survey that we did, especially in the promise zones, identified that space area, safe spaces, youth engagement, and employment opportunities were the pressing concerns of these areas. And then what the areas are in need of assistance in is crime reduction, combating gun violence, and addressing drug-related activity. We intentionally opt demographic information, so we didn't ask the participant to provide any race, age, or gender, and that's because we wanted to get the voice of the community-wide perspective rather than just an individual characteristics. And I think one noteworthy observation in this survey was the commitment that the community is willing to do if an opportunity is present to them, which you could clearly see in our results. 90% of the community members are eager to come together and address issues at hand, and approximately 50% of our populations in the zones reported feeling somewhat safe. So this is their neighborhood, and they've spoken basically with this survey. So thank you. And I think we're gonna go on. Yep.
Thank you, Ferris, for that information. And as we move forward with that information gathered within the promise zones, that's how the promise keepers will lead a lot of their efforts. It'll be based off of what the community is saying that they need, what they want to see more of, and what they want to see less of. Their voice will lead a lot of our community efforts. Now we'll do a Menti poll just to get some of your feedback in regards to the information that you've heard. So there's two ways that you can do it. You can go to menti.com, or you can use your phone and scan the QR code. This will give us an opportunity to get some of your feedback and discuss some of your feelings in regards to the information that you And I'm just going to scan it with my phone as well. And then I believe Robert will be taking over.
Yes, thanks, Quinn. Robert Walker, public health strategist with the City of Milwaukee Health Department. If you could continue to add your feedback, and we will share the results. Okay. Right, it looks like youth safe. Look like some great feedback coming through. Also look like from your feedback, social medias has been a thought, youth engagement, health. These are all great thoughts in how we all could actually align some of the work that we are all doing. It seems great, great. So continue to provide your feedback. Looks like there like some great opportunity for us to collectively work on some of these areas with the Office of Community and Safety, Wellness and Safety within those promise zones. And so thank you so much for your participation. We will definitely take these into our next meetings to discuss how we all can be in engagement with that. And so now we're going to go to the next slide. We will go into our data and evaluation plan. We are currently in phase 2, and would like to pass it to Ferris again to go over. I've been able to reach out to a couple of our implementation partners, so around the data and evaluation plan. I will pass it to Ferris to go into depth more about the data and evaluation plan.
Thank you, Robert. So one of our um, one of our works that we do for the CHIP is to establish a data and evaluation plan. So here we have 7 phases, and the phase 1 was basically to identify any metrics that align with MKE Elevate strategies and highlight any strategies that can be effectively measured by metrics. So the phase 1 was our data and evaluation team basically just sat together and we brainstormed any metrics that can be aligned with all the strategies that the public health strategists, such as like Robert, Amanda, established within the CHIP for each priority area. And then for phase 2, now is the strategists are asking all the action team members or to try to find any partners that could help us find the missing gaps of each strategy that doesn't have a metric assigned to it. And we'll go over that in more detail. I just wanted to emphasize the phase 1, 2, and then moving forward. And then once we establish phase 1 and 2, and we've completed that, and we've assigned metrics to all the strategies. Sorry. What we're going to do is for phase 3 is defining roles, responsibilities of the data collection and management for each strategy with the metric. And phase 4 and 5 is basically establishing baseline values, targets, and any outcomes that the action team partners and the data evaluation member and the strategist can agree to. And then phase 6 would be deciding on how to communicate the progress to the community. And then phase 7 is providing updates to the community as well. So this is a collective community approach. We want everybody to sit on the table and start brainstorming. And if any of our action team members here know of any metrics that could be aligned to a strategy that's missing an indicator or metric, please let us know. And let us know any organizations also that could help us capture the significance of the strategy to see if it's, doing anything within until 2028, which is the chip process. And if we go to the next slide. So for here, so we have goals. So our first goal is to increase efforts at levels to prevent sexual and domestic violence. And I believe, Robert, the action team members here have seen this before, correct?
Yes, most of us have seen it in our prior meetings.
Okay.
Yep.
Perfect. Thank you. So for this one, we're increasing the efforts at levels to prevent sexual and domestic violence. So the objectives here, there's two objectives: building community capacity to respond, and then grow cultural response approaches. So just to let you guys know, the highlighted yellow are the strategies that are missing data for. So this is what we're asking each one of you if you could help fill these gaps in. So we could go over some of the strategies. So the first one is promoting a citywide restraining order awareness for victims of IPV. Second one is implementing credible messenger programs to directly connect with communities most impacted by IPV. And then if you look at G, promoting individual and systemic advocacy, developing and implementing an effective communication strategy, promote healing and restorative justice approach. So this is what we're asking. The strategies that are highlighted in yellow, we need data to show these strategies if they're working or not. And then if we go to the next slide. For this one, for goal 2 is supporting the increase of fostering safe neighborhoods. And you can clearly see we need help on this. We need to get some data for these strategies. There's 3 objectives here: increase access to care, offer community trainings, and then strengthen capacity and coordination of violence prevention efforts. And then the highlighted ones, we'll just go over the highlighted ones. So community access to recovery service provider network, offer bystander trainings, offer CPR trainings, teach conflict resolution at schools, churches, and CBOs, implement system level recommendations that move upstream of violent events, increase collaboration across organizations and sectors. Next slide. Goal 3 is to decrease risk factors for reckless driving. So the objective here is to increase education and safety, and then the strategies are all highlighted in yellow, is what we would seek assistance from you guys. And then next slide. So goal 4 is to improve the availability and the uptake of behavioral health resources for Milwaukee. So the 2 objectives here is community-based crisis response, and then provide efficient access to care. So we can go over some of these. So like promoting suicide awareness. So I did want to let the action team members know some of these strategies, you really can't get like a straight like data point to it. But what we could do is, like, for instance, like Robert will talk about that in a second, but so like promoting suicide awareness, who in our action team members here for the SCC priority areas are providing that? Who's offering like supported loved ones for lost members to suicide, or offering mental health mobile units? So stuff like that. So this is why we need to do this as a community whole, and to brainstorm potential partners that could help us with the strategies that are missing data for. And we could go to the next slide. So goal 5 is to promote efforts and individual, community, societal levels to increase harm reduction methods through the city. So our 2 objectives here is have community events to build awareness of harm reduction resources. And the second objective is to increase access to harm reduction distribution services. So maximizing supply, coordinate efforts of communication of resource supply, Narcan vending machines, MATs, over for this one would be Milwaukee Community Collective Substance Misuse Anti-Stigma Campaign, harm reduction trainings. Like, who in our community can provide these trainings? Who knows like of the how many Narcan vending machines are currently available throughout the Milwaukee County as well. So it's, you know, just stuff like that. And then next slide. And then this is I'll pass this to Robert.
Thank you, Ferris. So currently, after the inventory of the data that we currently have, we currently identified specific in these specific areas of the chip, our priority areas for between 2023 and 2028. So we're currently looking to gather more data, but currently we at the safe and supportive communities priorities and for our action team, we only have 12. We need 12 currently. So we of strategies, and we need as far as metrics and things, as you can see from Ferris's that presentation. We are looking for those areas, and so feel free if you do know anyone or have anyone, organizations that are working in these specific areas, and we will have opportunity after this to talk more about that. We can, but before we go forward, wanted to make sure if there were any questions. I know there was a lot of comments also in the chat regarding the Promise Zone survey outcomes presentation, and also the data inventory plan. Feel free, this is the time if you do have questions. I did miss a lot of them in the chat, but you can currently, I wanted to make sure I have space for those questions.
So this is Connie from MCW. So just to clarify, if we think we can assist with specific data or contact people, you want that, but then also if there's potential alignment with other work on some of these strategies, you're looking for that as well?
That's correct. That is correct.
Okay, so I do definitely have some thoughts on that. It might be a little too much to put in the Menti, so can we just do a follow-up after the meeting as well?
Absolutely. Absolutely. Thank you. We can definitely connect, or anyone that is able and willing, feel free to reach out to myself. I can also provide some more in-depth info regarding some of the asks around data.
And then a quick question, do you have a timeline that you're working on to either A, see some data in place, B, follow up with key stakeholders, anything like that?
Yes, thank you for that. So we would like to do it, have the information as soon as possible. Or I mean, a timeline was prior, but I know it takes time with meeting with stakeholders and gathering what information that we need and that we can be able to support. And so we want to do it by the end of the year, but we know, like I said, with the time frame of meeting with folks and trying to gather and collect the data, it take a little bit more time. So we're hoping by January 31st, we can have everything collected as much as we can from stakeholders and implementation partners. So that is the date that that was the deadline that we're hoping to get everything completed.
And then is a plan for like MSD to be like the secure broker for the data, or is that TBD?
So we are planning to be the data holders, with Ferris being the lead on that. Him and his team, our data team, we're planning to have that as being the collector holders.
And to answer or to add a couple more things, Chief Parrish, basically what we're trying to do is also when we gather all the data, we wanted to see what way would be appropriate for us to disseminate it to the public and to our community partners as well. So we haven't really we're in it, this is in the planning stages right now. But so the first two is just establishing all the metrics with aligned strategies. And then from that, phase 3 and 4 is to figure out, okay, which partners are going to give us the data, what time, like what time frame, how are they going to provide it, stuff like that. And then after that, phase 5 and 6 would be the ones where if it's going to be like a report card style or if it's going to be like just a infographic page, we still haven't, we're still working on that, but that's how it's more likely going to be.
So then maybe are you looking for like a data dictionary then maybe for January 31st, or trying to
Yeah,
figure
so
out
the,
identify
so
and so forth?
yeah, so hopefully we're for quarter 1 for next year, we want to establish the data dictionary into the data inventory as well. And then that way anybody will from our team will know, okay, I need to reach out to this person to get this data for this strategy. So everything will be aligned and everything. And then obviously our partners as well will have a chance to look at that as well.
Yes, Ferris and Robert, is it possible to receive the slides outlining the goals? I completely missed goal number 3, and that's the one that Milwaukee County DOT would be most involved in, reckless driving. There's data that we probably can provide you. I just need to know the questions that you were looking for.
Yes, we can provide the slide to you regarding those goals and data asks. I normally send out a regularly email to the action team and just to provide updates. So I can also provide that the slide as well.
Thank you.
No problem. I see Al. Do you have a question? You have your hand up.
Yeah, Albert Robbins, Father Making Progress. Just wondering, do we have access to those slides after this meeting?
Yes. I will create a follow-up email to you, to the action team and the implementation partners with the presentation slide.
Thank you.
Okay, I noticed a lot of questions in the chat, so I'm hoping my team is answering some of those as they come in. But we will, as they are, we're answering them. If no one has any other questions regarding the promise zone outcome surveys, the survey outcomes, or the data inventory plan, we will.
Robert,
Oh, yeah.
this is David. Sorry, Peggy had a question, then I have one after her.
Okay.
Sorry about that.
No problem. No
Go ahead,
problem.
Peggy.
Hi, everyone. Yeah, I did get something in the mail about missing data. And I know that I did the sticky note thing. I forgot what it's called, the jam thing, and I put information in there, but I don't know exactly what you want me to do. There's missing data from us, but I don't know exactly what to do or how to present it to you. So if you could help me with that, that would be great.
Absolutely, absolutely. I'm not sure. Did it come from the health department or was it?
It says SSC data inventory phase 2 missing data.
Okay, okay.
So, and then it has all of the stuff that you were talking about. But I participated in the last event like this, and I did do the Jamboard. So I'm not sure. I don't know what you need. I'm more than happy to help and give you whatever it is you need and answer those questions, but I don't know how to do that.
Sure, sure. We can definitely connect offline and I can um uh give you the process on how we can work on collecting data and any data that you may have and that can align with the data inventory plan. Thank you. David?
Yeah, thank you. Appreciate it. I'm sorry, this is my first meeting I'm making, and I apologize for not making others. So please forgive the question if it's been taken care of. In thinking about what data might exist, has this, and we're really a rich group, so I think we probably know enough here, but have we cataloged who's doing work in these areas? Or do we have an understanding of the organizations doing the work in these goal areas? Because that might help at least me think about what other partners and data might exist and who's not at the table, but just wondering if that's happened yet.
Yeah, thanks for that question, David. So, we are in that phase where we've collected exactly what we are able to collect as far as data. But we're hoping in this phase 2 of our data inventory plan is we gather as much from our partners as possible. And then in the next phase, we would be able to know who's missing from the table or what data is missing from the strategies that we have accumulated from the community, and that will be kind of that process to reach out to more organizations that may not be at the table that we should bring to the table, or the missing data that we may need.
Yeah, I guess I want to clarify too, not so much the data piece and what's being tracked, but like who's doing work in each area. So for example, for domestic violence and sexual violence, do we have a list of all the organizations who have programming in this area?
Yes, so
Okay,
I did as we go forward in the presentation, I do have a collective of the implementation partners that we currently have.
gotcha. Yeah.
And so that will answer your question as far as like who we have at the table and who we're currently working with.
Well, thank you.
No problem. Okay. All right. Okay, Al, you have another question?
Yes, real quick question. Al Robbins, files making progress again. Um, I think it was question number 4. I think they were talking about it was an open-ended question on the survey or whatever. Is
Mm-hmm.
that correct? So what does that look like? Was it done on a tablet or people just wrote in their answers? How did that go with that answer there?
Sure, I'll leave that to Ferris and Quinn to answer that question.
What was the question again? I'm sorry, I was answering questions.
I was just asking about the open-ended questions on the survey of the residents. Was it a write-in kind of thing, or was it a scroll down thing where people just got to pick and choose what they wanted to say? Or
Yeah, so for the question stating what would you see more of or less of, that was an
yes,
open-ended question so that they could physically write it.
thank you.
No problem.
Okay. Thank you so much for your questions and engaging. We definitely want to make sure that we are expressing the need and appreciate all your efforts and works in being a part of our action team, because we have to be able to do this to collectively in order to really create impact. So and that's where we are our guiding principles. So we definitely appreciate your support in all these areas. If we can go back to the presentation, and feel free to continue your questions in the chat.
Robert, did you mute yourself?
Can you sorry, I think I did.
Yeah, you now.
Okay, great. Okay, so we're now have a presentation uh from overview, excuse me, highlighting one of our community partner implementation partners, which is from WesCare Wisconsin Incorporated. So I will pass it to Travis, or pass it to Quinn to introduce Travis. Thank you.
Travis Landry is the vice president of WestCare, does a lot of amazing work, been a great partner for the Office of Community Wellness and Safety over the years. They work in the realms of substance use disorder, mental health disorder, domestic violence, homelessness, offender reentry, have a food pantry. I believe they disassemble food to the community every Wednesday. They also have credible messengers, do a lot of amazing work in the Harambe community, but not just Harambe, throughout the city of Milwaukee. So thank you, Travis. When me and Robert originally were talking about implementation partners and who would make a great fit, WestCare was one of the first choices that I made, just knowing your impact in the Harambe community, and your reach. So I thank you, Travis, for being a partner, and I'll let you take over.
Thanks, Quinn. I appreciate that. Travis Landry, Regional Vice President for WestCare Wisconsin. WestCare is actually in 17 states and 5 trust territories, so we have a wide reach of reaching individuals everywhere we reach people. We have different services that we provide, so we're not McDonald's. We don't provide the same Big Mac in every state that we're in. In Wisconsin, we do a lot of community-based organization work. We do a neighborhood improvement project, which is helping homeowners, low-income homeowners, provide stability to their property so they can sustain it a little bit longer. So we'll put up to $50,000 worth of rehab work into qualifying individuals so that their roof, porch, electrical, plumbing could be sustainable to keep them from going into foreclosure. We do community organizing in 2 areas, NSP 6, which is the Harambe community, and NSP 8, which is the Metcalf Park community. We provide youth services where we just give kids a better quality of life. We address their quality of life issues. Our services for our youth is intended to increase the skill level and readiness for employment. So we work with anywhere between 10 to 24-year age youth. We provide a food pantry every Wednesday at our office from 12 until all of the food is gone. Prior to COVID, our food pantry was once a month, and we were serving around 50 people a month at the food pantry. Since COVID, we serve over 300 people that come across the entire Milwaukee County at our food pantry every Wednesday. And then in the summertime, we'll barbecue. So we'll put some burgers and hot dogs or brats on the grill for the residents, because we've noticed during the food pantry, a lot of people don't have a refrigerator and or stove or microwave. So since we're blessed to eat a hot meal every day, we make sure everyone gets to eat a hot meal every day. And we'll have people sitting in the parking lot all day long, eating 6, 7, 8 hamburgers, taking some home, because it's important. We do substance abuse prevention inside of Milwaukee Public Schools. We have a Botman Life Skills grant from the federal, from SAMHSA. We go inside of 5 K-8 schools and provide life skills and substance abuse prevention. We do special economic development training for contractor capacity building. You know, Milwaukee does not have enough minority contractors, so we provide lead training. We provide assistance with getting your state and city certification so that you can be a licensed contractor. And then we use that to give them work, to give contractors work through our NIP program when we rehab the houses. We do a drug-free community in 53212. Get youth engaged with different sector members to be a part of just a drug-free community, to spread the word, to let them know that the kids do a lot of advertising based on how they feel about drugs and how they can help prevent. We do our Cream City Credible Messenger programming with Milwaukee County. The Department of Health and Human Services is a great advocate for the Credible Messenger program, where we get youth referred to us from the Bell Phillips Detention Center so that we can provide some stability and a better quality of life for all of the youth so they can help reduce recidivism. We have a Junior Youth Action Council. With our Junior Youth Action Council, we partner with Beulah Family Homestead, which is a farm that, you know, that I'm proud to say my cousin, who retired from professional basketball, he came back home and bought a farm, and we provide 8 to 10 week course to teach young people about the food they eat. And we start with chicken. So they'll either have a 10-week course on egg-laying chickens or a 10-week course on meat chicken. And they will learn the egg and they will learn the meat of a chicken. And at the end of this course, we have a gala where we have jerk chicken. And either you're going to enjoy what you learned or you're going to become a vegetarian. One of the two is what we've noticed. We actually part of Milwaukee Community School Partnerships as well with United Way. So Martin Luther King Elementary School is one of our community school partners. We do a lot of activity at MLK Elementary School. One of the activities we do is Juneteenth. We have 3 years ago started the Kid Zone on MLK parking lot. And we serviced this year alone over 2,000 kids with fun games, activities. We bring the animals out there. So they got horses, chickens, cows, you name it. It's at MLK for kids 14 and under. Along with our drug-free community, we have a comprehensive addiction and recovery grant that service grassroots organizations that help pull Narcan training and CPR training and other activities together so we can train as many people as we possibly can in Narcan and CPR training and therapeutic training. We do a fundamental basketball camp. We've noticed that with the fundamental basketball camp, that's really how a lot of kids get engaged into just being taught. You know, we just give them something that they love to do, and basketball is what a lot of kids love to do, and that's how we start teaching them. We have our clinical division as well, mental health and substance abuse clinic, where we are the access point for the north side of Milwaukee, through Milwaukee County as well, Department of Health and Human Services. And the clinical part was very important because people really don't understand mental health or substance abuse until you become a part of mental health and substance abuse. And I'm saying people, and I'm using me as an example. I didn't understand mental health until I got into a mental health crisis and really needed to talk to someone about mental health. And that's how I developed a clinical division, because after I was talking to Dr. Fossey, you know, I was just like, this was good. We need to do this more often. Let's come together and see how we can collaborate even more. And we started our clinical division. Dr. Fossey came over as of February 2022, and it's been a blessing ever since. So anyone that come volunteer with WestCare, I make sure they get a mental health assessment. It's very important. We do mental health first aid as well. We have another federal grant. Our mental health first aid training is to the faith-based community. We do this in Wisconsin, Georgia, and San Antonio. And it's important because a lot of people go to their pastors for support, but their pastor's not trained in identifying mental health. So our goal is to train every faith-based organization in mental health first aid so they can understand mental health and be able to refer people to get the proper help that they need. We provide also our Narcan training and our CPR first aid, telehealth, and other therapeutic service through our Man Above vehicle. We have a 16-foot mobile vehicle that's called the Man Above, and it's in honor of one of our employees who was who lost her life due to mental health and other issues. So we dedicated this vehicle specifically to her, called the Man Above, because her last name was Man. Other than that, I wanted to keep it short and brief, but I wanted to share some of the services that we provide at WestCare. And I also want to give my disclaimer that we at WestCare don't think we have the answer to everything. We provide a service because someone has knocked on our door and we may have referred them to someone else and they didn't get the help that they decided that they felt they need, and they came back to our door. So we had to create something to make sure that when you leave our office, you're going to be whole. You're going to have the help and assistance that you need. And, you know, it's important to me because I promise you, when mental health really hits you and it hits you hard, you got to be prepared for it. And if you're not prepared for it, people go slip through the cracks. And I you know, this job is so serious. I don't even like giving my title. I like just being Travis, the person in the community that can help people when they need them. And I see Chief Lipsky on the phone. I still owe you some gun locks, and I got to connect with you so I can make sure I get you your gun locks. I thank you guys for the presentation.
Thank you, Travis, for that information. Thank you for all the work that you and WestCare are doing. It really speaks volume to the advancement, to the improvements that we're seeing in the Harambe area. And all over the summer, our Promise Keepers, one of their focus were beautifying neighborhoods. And Travis and WestCare has been a big partner in a big clean and making sure that we had the equipment that we needed during those cleanups. So again, Travis, my hat's off to you. I thank you for the work you and WestCare are doing. Pass it back over to Robert.
All right, thanks, Quinn. Was there any questions that anyone had for, or comments they had for Travis and the work that WestCare is doing? Okay, Peggy.
Hi, Travis, my name is Peggy, and I'm a member of Narcotics Anonymous, and I have mental health issues as well. I put that information in the chat along with my email. So if there's anything we can do to collaborate, I'd be more than happy. I am the PR chair at the moment, and I will always be a part of PR, which is, you know, public relations and public information. I have resources. Please let me know if I can help.
I am sending you an email right now, Peggy. Thank you so much.
Okay, any other questions or comments or concerns?
I have a question for Travis.
All right.
Good morning, everyone. My name is Patrice Travis, and I'm interested in the wellness training that you offer for the mental health for people to be able to identify. How can someone in the community be a part of that training? Is that specifically for the faith-based?
Well, I'm glad you asked that question. Do you believe?
You said, do I believe?
Yes.
I'm a believer. I
There
just
you go.
wanted to know if you had to be.
You're part of the faith-based community then. So it will be offered to you free of charge. And you can be coming to one of our community classrooms. And then when you go connect with other believers, if they need mental health first aid, they're more than welcome to take the training. This training is very important. you know, the reason I have mental health issues is because someone just shot me and I just got shot. And at the age that you get to a certain point, it kind of messes with your psyche. So you don't know how to handle something just happened to you out of the blue. So you got to continue to talk to someone. And it's very important because, you know, when I got shot, I went to my pastor to talk to him and he didn't know how to handle it and really stopped talking to me. People think that mental health is really a person going crazy or a person, uh, um, being abused, or no, it's just really having someone to talk to be able to identify that you just got some issues. And you know, we all have mental health issues. We just don't identify it as mental health issues, but we just talking to someone to get it out so that you can help heal whatever the issue is you have going on. And you can definitely drop your email in the chat and I could get you to be a part of the training for mental health first aid.
Thank you so much.
All right. Well, thank you again so much. If you do have any more questions, feel free to put it in the chat. And again, we appreciate Travis coming. At MKE Elevate, we are working to create relationships in the community, those that are currently doing the work, and we want to highlight those that are our implementation partners that has signed on as we continue to learn and work together for the priority areas and how we can align some of the work and how we can support each other. So just wanted to highlight a couple of those, which was that we shown with WestCare. So thank you again. Can we go back to the presentation? Thank you. So wanted to kind of go into our 90-day action plans, because I know there was a lot of questions around like how do these align, what is it regarding MKE Elevate. And so so our first objective regarding MKE Elevate, as you can see on the side, we do have our goals and our priorities and our vision and objectives. And so we're streamlining that specifically around safe and supportive communities. And so the first thing we're doing by the end of the year is to complete the data inventory plan. Secondly, to partner and continue partner outreach, and to also do some background research regarding, evidence-based strategies and initiatives that we could really do some deep dive into the work regarding MKE Elevate. So those are the areas that we're working on within the end of the year and ongoing in the beginning of the year. Next slide. So how we are collectively working together around the level of involvement. So for MKE Elevate, we have specific areas that we receive actually a template from the Milwaukee Healthcare Partnerships on how we want to lead, participate, and monitor. So so MKE Elevate provides, as far as leading, provides staff to support resources, establish and monitor work plans and metrics around evaluating and communicating processes and progress on outcomes. So, so that, for example, we have in one of our priority areas within racial and health equity is we're working on guaranteed basic income. So that is an area that we are currently working on in that space. But and I'm going to go into deep dive around some suggestions that we have for the safe and supportive communities that we will like to share with you regarding how we could lead. But we definitely are open to suggestions or feedback on opportunities that we can lead some of this work. Participant is other organizations that are providing leadership in some of these in areas of the priorities and strategies. MKE Elevate will have staff to or members serving on the steering committee or the work group to help support in the leading organizations that are already established and just monitoring the work in their work plan and establishing some metrics specifically around some of the MKE Elevate work. And so that is participating and how MKE Elevate will be participating, and then monitoring. So that would be others organizations that is leading, but MKE Elevate staff and member participant on like ads as far as HOC basis of information only. And so those organizations that are leading, establishing some of that work and their work plans and metrics and progresses and outcomes, we are willing to be in like monitoring that work. So some examples for participation was, as far as Vision Zero. And then another example for monitoring would be like job readiness, like, those that are working in those areas, we are currently just monitoring. But as far as participation, as far as Vision Zero, we're as a MKE Elevate staff, because they are implementation partners, they are leading the work, but we are here to be a support in any area that we are able to participate. Next slide. So as far as our 90-day plan for the safe and supportive communities, so the focus areas, so right now we have implementation partners. We have 25 partners that are signed on, 5 partners that we have reached out to, that we want to continue to reach out to, 19 partners that we have to follow up with, and then we have 9 partners that we're currently just building relationships with. As far as the data and evaluation inventory, so currently we have 19 metrics identified, and we're requesting data from 25 partners. So that has already signed up. So as far as action items, we want 29 metrics needs to identify, and we want to determine the role and responsibilities as far as that lead participant in monitoring. And then again, with the we're going to create report cards with 2023 baseline data and 2028 targets. Then as far as the background research on strategies for MKE Elevate leads, we have the suggestion, as I mentioned, as far as community-based crisis responses, want to offer like the awareness, as far as increasing the awareness of community-based crisis response, like those who are offering mental health mobile units. So our action steps is to start a lit review for the 4.1 action priority. So community-based crisis response, and to offer mental health mobile unit strategies, and then hold 3 informational meetings to learn more regarding those efforts. Next slide. And so as a health department, we are required to do 2, as far as accreditation measures, we are required to do 2 policy strategies. So that is why those areas that we would suggest to lead in as an action team and implementation partners, those are just some areas here where for supportive communities, safe and supportive communities, to increase awareness of mobile unit crisis response, and then also to for the behavioral health affordability issues. Want to see, work on and navigate how we can collectively work to lead that, but also with you all our support to help. And that again is just 2 of multiple things that we want to participate in and monitor within our strategies for the priority. Next slide. So as far as the safe and supportive community partner list, these are all the partners that we currently have signed up, and we are currently looking for more. And I know we're running out of time, so I won't go into every one, but as you can see, we do have a lot of partners that specifically with safe and supportive communities that are that is already signed up. So we are continually working to build more momentum on getting more partners signed up regarding the work in specific specific areas. Okay, next slide. Okay, so I know we only have about 5 minutes, but I think it's important that we talk more in breakout rooms to talk about those priority goals, objectives, and strategies for next year. So if you do have the time to be a little bit over 12, we truly appreciate it because this is the meat of everything. So these are the questions that we're going to ask in the breakout groups, and so Amanda is going to disperse us out into breakout rooms to talk more about these priority areas and also the next steps for our data inventory plan.
Oh, and just a quick question. So we have someone on the phone with a number ending in 9225. Are you on video as well, or I just want to know which room to send you to? So if you have the 414-501-9225 number, could you just come off mute and let me know your name?
Hi,
Hi.
I am actually on the Zoom call.
Oh, okay. So what's your name so I can send you to the right room?
Okay, unfortunately, I am actually at work and I
Oh,
work
okay,
in a
yeah.
school. So I don't know if I can do, because I'm feeding the kids right now and they're really, really loud. So
Oh,
I
yeah.
don't know if I could join. Okay,
No worries. Yeah, we'll let you go then.
okay. I have enjoyed the meeting. Everything was awesome and I am so excited about getting started. I will contact Robert
Yes,
because that's where I
absolutely.
got the information from.
Yep, and he'll send out a follow-up email to you with a recap of the meeting. And if there's any other comments or feedback you have, feel free to pass them along.
Okay. Thank you. You guys have a good day.
Yeah, you too. Bye.
Bye.
I don't know about everybody else, but we really didn't have enough time to really get into our questions, but we did get a couple of them answered. Robert, are you still with us?
Yes, I am. The same here. We didn't have enough time. And truly apologize about that. Um, you just never know with so much information and in the dialogue that we've come across that we wasn't sure if we're going to be able to get through all of it. We were hoping, but I'm hoping that for our next meeting, we will be able to have more time to collectively work on these. And I'll also be in communications by email. So if there is anyone that do have I'll send out the questions, and from the information that you've received today, feel free to send that your thoughts and your ideas on how you would like our team to strategize in these areas and priorities. If we could go ahead and put up the rest of the presentation, because I know we're much over the time. I know some had to leave. So Amanda, if you can put up the present, so yeah, thank you. So next steps, if we can go, so for next steps, we'll be hosting one-on-ones with each of one of you, reaching out to just ask those questions of those that may have the as far as the data inventory plan and as far as the strategies and how we should go about working towards the next year. And so we'll be meeting with you all ongoingly within the steering committees as well. We will be meeting with them as well to talk about some ideas and strategies around the work as well. We will be creating a press coverage plan for the chip release in November 13th. And so we have our leads, Alex and Annika, and the leadership and communication team. We will be working on that. We also will be having a report launch party. And I believe, Annika, if you're still on, if you could share that in the chat as well. Another thing that is not in this slide is our Advocacy 101 training that we are having as well for action. For our action team is available to the action team to be a part of. So if anyone is interested, feel free to reach out to the information that we have in the chat. And then so again, we're going to continue to host one-on-one meetings and connecting with more partners around this work. We also have a Spanish version of the community health improvement plan. So we're going to have focus groups as well for just to have them learn exactly what the health department is doing and how we can be a support. And so you can register at the launch party at the link that is above. We will be having a evaluation. That isn't the evaluation, but in the emails that I'll send to you as a follow-up. And then if you are interested in being an implementation partner, we have a Google link as well there. All right, next slide. Okay, if you have any questions, feel free to reach out to the email that is on the screen, MKE Elevate at milwaukee.gov. You can also always reach out to me as well for any questions or comments or concerns that you may have. And thank you. Thank you. Is there anything else that anyone would like to mention before we close out?
I just want to add real quick, great job, Robert, in putting this together. I thank you for your commitment to the community. Ellie, my community co-chair, I thank you for facilitating. Thank you for all the information and talent that you bring to this as well.
I
Absolutely.
feel the same way. Thank you so much. I never imagined, I'm clean now. I'm in recovery. I'm part of Narcotics Anonymous. Never imagined I would be sitting in a room with all you beautiful people. So I want to say thank you for all your hard work.
Thank you so much. I wouldn't be able to do it without every one of you. Thank you, Quinn, as well, and Ali, for being co-chairs and being in all that you've been doing and the work that you've been doing in this work. So truly appreciate. Okay, if there's nothing else, I will definitely be in contact with you all, and look forward to the emails, a follow-up email, and hope to see you in our launch party in December. Take care, everyone.
All right.